Good afternoon. Am I speaking to Miss Ekarista family right now? Okay, Miss, I'd like to inform that your daughter is currently being treated at our hospital. Yeah, please come to our hospital as soon as possible. Okay, thank you. Miss, are you okay? Are you okay? Wait, I will call ambulance.
My leg is hurting so bad.
Okay, I will call ambulance. Hello? Please send help immediately. We need help because someone has fainted at University of Pelita Harapan.
Feel dizzy.
Yes, and she feel dizzy. Please hurry.
Excuse me. Okay, Miss, can you say your full name and your date of birth?
My name is Ekaristia Stefanus, 18 January 2006.
Okay, so how are you feeling right now, Miss?
I'm feeling dizzy and my right leg feels so much hurt.
Your right leg. Okay, so for now I'm gonna check your heartbeat first with stethoscope. Okay, just be relaxed. Excuse me. Okay, so Miss Eka, because you have a heart in your nervous system here, so I'm gonna call the nurse to check your nervous system assessment. For the full assessment, it's gonna be the nurse will become here, and I'm gonna call the nurse. Okay, Miss, for a while you can take a rest, and I'm gonna call the nurse to have a full assessment for you. Okay, excuse me. Excuse me, ma'am.
Thank you, doctor.
You're welcome. Morning, Doc. Okay, good morning, Nurse Ailey. So we have a patient that in the SL number 15. Her name is Miss Eka and has a pain in her right leg. So can you do the full assessment of the nervous system? Is it a patient? No. You have a patient? So you can take this.
Thank you, doc.
You're welcome.
Good morning, Miss. Good morning. Okay, Miss. My name is Nazrani Hafilar, and I will be your nurse from now until 12. Can I have your bracelet, and could you please say your full name and date of birth?
My name is Ekaristia Stefanus, 18 January 2006.
Okay. So, based on what the doctor has informed me before, you said that you have pain on your leg, and based on what the doctor have recommended to me, I'm gonna assess your nervous system from your head until your toe. I'm gonna ask you to stand and walk for a bit. It takes 20 until 30 minutes, and the place is just in here. Do you agree with that?
Yes, nurse.
I'm gonna prepare the tools first, maybe 5 minutes, and you can have a rest. I will be right back. Excuse me, I'm back. Okay, I'm gonna wash my hands first. I'm gonna help you to have a comfortable position. And can you have a seat?
Yes.
Okay. Do you want me to help, or you can?
Maybe you can help me too.
Okay, so for the first assessment, I'm going to assess your nose, and I will ask you to clean your nose first using the tissue. Okay. Oh, for the first one, I have some examples of smell in here, and I want you to smell it, but you have to close both of your eyes and one of your nose, and then you can smell it and guess it. What is the smell? You can start closing your eyes.
You got this. So.
Okay.
So.
Next one.
Coffee.
Okay, open your eyes, please. Okay, Miss, we're gonna continue the assessment, and for the next one is your eyes. So I have text right here. You can read it for me. This one.
Biceps reflex, triceps, the Achilles tendon.
I'm gonna assess your field of view, and I will put my hand right here. The first time you saw my hand, my finger, you can raise up your hand. Okay. We're gonna start. One. Okay. Okay, for the next assessment, I will put my finger in front of your eyes and you have to follow it, but don't move your hand, okay? Okay, we will start. Okay, now we will continue. I'm gonna ask for permission to see your eyes. This. Okay, so for the next assessment, I have a stool. This is the sharp one and this is the dull one. So I'm gonna give a sensation on your face and you have to guess it with your eyes closed. Okay, can you close your eyes, please? This is the example. This is the sharp one and this is the dull one. Okay, we will start.
Sharp. 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 Sharp.
Okay, Miss. So for the next one, I'm gonna assess your face muscle and let me touch your face right here and this side, and you can bite your teeth. Can you bite? Okay, one more. Okay. Then I'm gonna assess your face muscle and you can bite your teeth while I'm touching your face. Okay. Can you bite? Again. Okay, so for the next one, can you smile? Can you raise your eyebrows? And can you make your face like... And we already assessed your nose and now we're gonna move to assess your ability to taste. I have sweet, salty, and bitter. And like before, you have to close your eyes and you can guess it. Can you close your eyes, please?
Salty.
Okay. One.
Sweet. It's bitter.
Okay, so for the next one, I'm gonna assess your hearing ability, and I will use the tuning fork. I will place it on your in here, and you can tell me first if the vibration is the same between the left and the right side. Okay, let's start. Is it the same? And then I'm gonna place it behind your ear and in front of your ear. So when you finish hearing the voice, you can raise your hand, and I will move to the front. Okay? The other side. This is me. Okay, so now I will ask you to stand up and close your eyes for about 30 until 60 seconds. And can you stand?
Okay.
Okay, can you close your eyes? Okay, Miss, for the next assessment, I'm gonna give a pressure on your shoulder and you can resist it, okay? Can you fight? Okay, again. And then on your cheeks too, you can resist my hand, please. Next one. Okay, can you move your tongue inside of your mouth, left and right, like, okay. Okay, Miss, you can lay down again and wake up. Now we will move to the next assessment, but first I'm gonna touch your hand and your foot. If there any pain, you can tell me. Is there any pain?
My right leg.
Okay. Next one, I will give some pressure on your both hand and foot, and you can resist it. We will start from the hand. You can resist my hand. Can you lift up your hand? Okay. Do on your
Little bit is okay.
can you resist it? Okay. Can you lift up your foot? Okay. If there any pain, it's okay. Okay. Miss, can I ask you to sit again?
Okay.
Help you. Next assessment is the coordination assessment. So I will put my finger right in front of you, and you can point from your nose to my finger every time my finger moves. Do you understand?
Yes.
Let's start. Okay, and for the next one, you can put your hand like this on your thigh and close, open, close, open. Okay, and I will see your ability to walk. Can you walk?
Yes.
Let me help you. You can just walk until there.
Until when? Can you help me or I'm alone?
You can do it by yourself.
Wait.
Can go back here. Okay, you can stay, and we'll do like before the assessment like before. You can stand and close your eyes, and you can lift up your hand like this. It will take 30 until 60 seconds. Okay. Start. So we're gonna move to the sensoric assessment. I'm gonna give like before, but now in your hand, and you can say if it is sharp or blunt. And can you close your eyes, please?
Sharp? Blunt? Blunt? Sharp? Blunt?
Okay, you can open your eyes. And now I will give the cool and the hit. Okay, so we're gonna move to the next assessment. I have the hot water and the cold water. You can close your eyes and you can guess it. Okay, can you close your eyes, please?
Hot? Hot? Cold? Cold.
Okay. So for the next one, I will give the vibration on your toes, and you can tell me if it is the vibration or not. So excuse me.
Yeah.
Okay. And for the next one, I will lift up your toe while you close your eyes, and you can tell me if it is up or down. Can you close your eyes, please?
Up? Down? Up? Down?
Okay, still close your eyes. I will give the light sensation, and you can say if you feel the sensation or not.
Light? 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 Light?
Okay, for the last one, I have a pointer right here. You can tell me if it is 2 point or 1 point. You can fill it first. This is 2 point and this is 1 point. Can you close your eyes, please?
2 point? 1 point? 2 point? 1 point? 2 point? 1 point? 2 point? 1 point? 2 point? 1 point?
Okay, we're finished for the sensoric, and then we'll continue to the reflex. Can I have your hand, please? Okay, excuse me. Excuse me. Excuse me, miss. miss. I'm gonna ask your permission to open your clothes. I will assess your abdominal reflex.
Okay.
Excuse me. Okay. For the next one, I'm gonna assess your plantar reflex at your foot. Excuse me. Okay. And for the last one, I will touch your foot and do like this. See? Is there any pain? Okay, miss, I just finished all of the assessment, and for the result, I will inform that to the doctor. Is there any complaints?
No.
Do you still feel pain in your foot? Okay, and then for the next 30 minutes, you can have a rest, and I will come to give you the food. Do you have any question?
No, nurse.
How about the family?
Nurse, what can we do to help the patient recover?
I think the patient must avoid to do the heavy things like lifting up heavy objects or sitting for too long.
Okay, thank you.
Nurse, will my sister be able to work again after this?
Of course, she will be able to work again if she has a good rest.
Thank you, nurse.
Thank you, nurse.
Okay, because all of the assessment is done, I will leave now. But if you need some help, you can press the button.
Okay.
Okay, nurse.
Thank you.
Thank you, nurse.
Good morning, doc.
Good morning,
Okay,
nurse.
so I already done assessing Mrs. Eka.
Okay, can I
and-
see?
Yeah, the result is in here.
Good morning, sir.
Good morning, mom, sir. With who I talk today, can you say your full name?
Moreno Sakti Nugroho,
Okay, and your date of birth?
28 October 2005.
Okay, do you have any complaints today?
My son is feeling nausea and also his right lower abdomen is hurt. Yeah.
Okay.
He also feel nausea and like want to vomiting. He also lose his appetite.
Okay. How about diarrhea? Do you think it's diarrhea or not?
Do we have?
No,
Just pain?
Yes.
Okay. Do you have take any medicine before this?
Like a painkiller.
Okay. Okay, so after you said that any symptom of this, I will recommend it you to do tests in the radiology such as USG or CT scan to see what happened in your abdomen. Okay, and also I recommended you to bed rest in our hospital. Okay. Do you have any question anymore?
How long does it take to
I think it depends to the medication, yeah. It depends to our treatment too and his condition after that.
Okay, thank you, doctor.
Okay, that's it. Good morning, Nurse Lulu. Morning, Dr. Tia. How are you today?
I feel good today.
Okay, so here I have a patient come to me. Okay, so he complained about pain in his abdomen and other you can see on his medical records I have been checked. He will bed rest. Okay, you do the assessment to him. He is on the room 16.
Okay, so our patient is Mr. Moreno.
Yes.
He's currently resting for bed rest in room 16.
Yeah.
And I will do an assessment for him to check what is happening that is causing the pain on his right lower stomach.
Yes.
Okay, thank you, doctor.
Just doing gastrointestinal assessment. And do you have any question after that?
No, doctor, thank you.
Okay, I will leave.
Okay, thank you, doctor.
You're welcome.
Good morning.
Morning, nurse.
Good morning, sir. My name is Nurse Lulu, and I will be your nurse for today. May I see your bracelet? Okay, can you say your full name?
Moreno Satya Nugroho,
Okay, what about your date of birth?
28 October 2005.
Okay, that's correct. So how do you feel today, sir?
I feel pain in my right lower stomach.
Okay.
So, and I feel fever, and I feel like vomiting.
Okay, you feel pain and then fever and you also vomit.
Yes,
Since when did you feel this pain?
since last night.
Last night. Okay, so what does the pain feel like? Does it feel like stabbing maybe?
Yes, stabbing.
Like stabbing. Okay, does the pain come and go or is it always there?
Always there.
Always there. What makes the pain feel worse?
When I walking, when I stand up.
Okay, when you're doing activities?
Yes,
Okay, what about what makes the pain feel better?
when I rest in the bed.
Okay. Okay, is the pain only in that area or does it radiate to other body parts?
Yes, just only in this area.
Okay, so only in the lower right stomach.
Yeah.
Okay, and then you said you also feel fever and also nausea and vomiting, right?
Yes.
Do you feel any other complaints other than that because of the stomach pain?
No.
Okay, so I have a pain scale from 0 to 10. So 0 is no pain at all, and then 1 to 3 is mild pain, and then 4 to 6 is moderate pain, and then 7 to 9 is severe pain, and then 10 is unbearable pain. So when you are doing activities, where is the pain scale?
I think 8.
8. Okay, what about when you are resting?
3.
3. Okay, so now I want to ask about your disease history. Do you have any history of disease that are digestive disease, such as maybe like appendicitis or stomach ulcers?
No.
No. What about your family?
No.
No. Do you stop consuming food or do you reduce food intake for any reasons?
No.
No. Okay. Do you have difficulty swallowing in your neck, maybe?
No.
No. Okay. Do you have any history of surgeries?
No.
History of accidents?
No.
Okay, do you feel any loss of appetite?
No.
No? Okay, then today I will be checking your digestive system or your gastrointestinal system. It'll just be here for about 10 to 5 minutes. So what I'm going to do is I'm going to check from your hair and then your eyes, your mouth, and then also I'm going to check your skin, especially your chest and abdomen area. So I'm going to need you to take off your clothes. Is that okay with you, sir?
Okay, nurse.
Okay, so now I'm going to prepare my tools first. I'll be back in about 5 minutes so you can rest. Good morning, sir.
Thank you, nurse.
Yes, excuse me, miss.
Thank you, nurse.
Morning, sir, ma'am. So I'm back with my tools. My hands first. Okay, sir, so now I'm going to calculate your body mass index. So can you please tell me your height and your weight?
My height is 170 and my weight is I think 68.
68. Okay. Okay, sir, can you please sit down? I'm going to check your hair first. Me. Okay, have you experienced any hair fall lately?
No.
What about headache?
No, nurse.
Nosebleeds?
No.
Okay, so now I'm going to check your eyes. Excuse me, I'm going to open your eyes. Can you look up? Okay, good. Okay, can you open your mouth, please? Lift your tongue. Okay. Okay, sir, now can I ask you to do this with your hand? So it looks like it's not dry and there's no lesions. I'm going to check your chest and abdomen area. So can you please lift up your clothes? Okay, sir, so now I'm going to check your chest and abdomen area. So may I please lift your clothes? Okay. Excuse me, sir. Symmetrical and flat. Do you feel any pain aside from the lower right stomach?
No.
No. Okay. Can you please point again where you feel pain?
This.
So now, can you please put both of your hands under your head? Can you please bend your... Okay, excuse me. Okay, you can lay back down now. So it looks like there's no problem with your abdomen. Okay, so now I'm going to listen to your bowel sounds. Okay, now I'm going to listen again, sir. Okay, so I'm done listening to your bowel sounds. So I didn't find any abnormal sounds. Okay, sir, so now I'm going to tap or percuss on your abdomen. Excuse me, sir. Okay, so now I'm going to measure your liver. So I'm going to percuss again and then I'm going to mark your abdomen with a pen. Is that okay with you?
Yes.
Okay, excuse me, sir. Okay, so sir, I'm done. Now I'm going to percuss on your spleen. Excuse me, sir. Can you take a deep breath? Exhale. Okay. Okay, sir, now I'm going to percuss again to check the fluid. Excuse me, sir. Okay, can you lay down to that side? Okay, excuse me, sir. I'm going to percuss again. Okay, you can lay back down now. Okay, now I'm going to palpate your abdomen, but I'm going to palpate the area of the pain last, okay? Excuse me, sir. You can tell me if you feel any pain. You feel pain? Okay, to palpate on the side of your pain, you can tell me how much the pain feels. Pain, okay. So now I'm going to do it again with more pressure, starting from this side again. You can tell me if you feel pain. Pain?
No. No. No.
Okay, now I'm going to palpate on the side of the pain. Excuse me.
This is okay.
Okay, now I'm going to measure your abdominal circumference. Sorry. Okay. Okay, excuse me, sir. I'm going to palpate again to check for abdominal aortic. Lastly, I'm going to be checking for appendicitis with 4 ways. So I'm going to close this now. I'm going to rotate it to the left and right. So if you feel pain on your lower right stomach, you can tell me, okay? Okay.
Yes, you have.
Okay, what about now?
Yes.
Excuse me. Okay, I'm going to open your close again. Excuse me. I'm going to press your left lower stomach. Feel pain on your right lower stomach. Please tell me, okay? Sorry, again. Okay, press again, but this time on your right lower stomach. Tell me if you feel pain. Okay. Okay, sir, so that is all for my examination. Did you feel any more complaints while I was doing my examination? Okay, so, but did you still feel the pain in your
Yes.
stomach? Okay, so I'm going to be checking with the doctor and also telling the doctor about the results. And you can rest for a bit. After this, I'm going to come again about like 2 hours to give you your lunch. Anything you want to ask?
No.
Okay, what about you, Miss Emma? Do you have any questions?
No, thank you, nurse.
Okay, so I will be back to bring his lunch, okay? Good morning.
Thank you, nurse.